Okay, so in that video you just watched, I was trying to demonstrate excessive knee flexion. The phases of gait that are going to be affected with excessive knee flexion include initial contact, mid-stance, terminal swing, and terminal stance. The functional task that is affected for initial contact is going to be your weight acceptance. This is due to the lack of ability to get a proper heel strike due to the lack of extension at the knee. The extension of the knee allows for a direct contact of the heel on the ground, which is the initial point where your body, you're starting to do a weight transfer into that limb, essentially, and your body gives a chance to absorb the shock, which gets into our task accomplishments in initial contact, which can be your shock absorption, forward progression, and stability. Again, I kind of already talked about the heel strike is big for shock absorption as well as stability, giving your body time to adjust to that initial contact and initial transfer of weight. But then forward progression, without that heel rocker, you don't really have the heel rocker is kind of like the starting point to the other rockers that you get. So without that, you have a little bit of like momentum loss. And then as you kind of saw, you have a shorter stride length. Yeah. Going into mid stance and terminal stance, which have the same functional and task accomplishments. The functional tasks seen there for mid-swing and terminal, not mid-stance and terminal stance, are going to be your single limb support, and then your task accomplishments, again, are your forward progression and stability. Going into terminal swing, your functional task that's affected there is your swing limb advancement. And I kind of already talked about it before, but without knee extension, you can't really get like a full stride, proper stride. So you're going to have a shorter stride length, as well as you're going to have issues with limb advancement. Yeah, so some of the potential causes for this excessive knee flexion include it could be as simple as the patient is in pain somewhere up the chain, or at the knee itself. Like, say they're having pain with the knee extension, they don't really want to be there, so they're staying in that flexed position. Yeah, so just be something as simple as that. They could have limited hip extension or stuck in hip flexion, and that could cause issues down the strain, and you have to compensate. Could also be limited extension arthros. Yeah, so those are just a few potential causes for excessive knee flexion.